Hey, I got it. Hey, everybody, welcome to Age-Wise Boston. My name is Mike Kincade from the Alzheimer's Association, and you are hanging out with us, and this is going to be an interesting program. Found out something just recently that I didn't know about, and I invited some folks on to come and talk with us about something that's going on in the neighborhood. And I usually, give a little bit of a more of a description, but this is such an interesting topic that I'm trying to squeeze so much in such a short, this is the fastest 25 minutes on television. So without further ado, I've got two incredible ladies here who are from the Roxbury, Jamaica Plain Substance Use Coalition. And I'm going to let them introduce themselves and tell us a little bit about what is the Roxbury, Jamaica Plain Substance Abuse Coalition. Let's start with you, Chioma.
Hi, Mike. How you doing?
I am in an air-conditioned building, so I'm doing good.
Thank you for inviting us. My name is Chioma Nnaji. I'm a coordinator of the Roxbury JP Substance Use Coalition.
Okay.
Deborah, you want to introduce?
I'm Deborah Milbauer, coordinator of the Mass Call 2 strategy, which is an overdose prevention project we'll tell you about.
Yep, okay. Yeah. All right, so I'm going to start with over here. We were talking, and Jamaica Plain, Roxbury, two incredibly diverse neighborhoods working together.
Right.
To do what?
To address substance use. I think that what happens is we might look at neighborhoods in terms of they're different demographically, but they're sharing some of the same issues and some of the same struggles. We are a coalition where individuals come to the table and say, we know that substance use is an issue in our community, and the community is Roxbury and JP, and we want to do something about it, and want to do something collectively, because we know that if you work together as a group, as a community, you can see more of an impact versus just one individual making a lot of noise or doing some work. So all of us are coming to the table saying that we're going to do something about substance use. We represent Okay. So we represent providers, people who are in the substance use field, who either are part of a community program or they work in a local health center, like Whittier Street.
RoxComp.
Or RoxComp. And we're also individuals, some of us are in recovery. So we've lived or have experienced substance use and found our way to recovery. Some of us are active users. And some of us are just members in the community who want to do something. So it's a diverse group of folks coming together.
Now, when you use the word substance abuse, and I know when I'm talking with folks, it seems like the drug of choice that everybody always hears about. I mean, good Lord, they make movies about it, is crack. Is there a bigger problem than crack in the neighborhood?
I would say there is, and I think it's easy for us to talk about some of those drugs that are illegal because we can easily point those out,
that's a bad guy.
Right, crack, cocaine, heroin, but we also recognize substance use as alcohol and tobacco, and often people don't talk about prescription drugs also, the abuse of prescription drugs.
The abuse of prescription drugs, right.
And also people don't talk about marijuana and its impact on us as individuals, our individual health, physical and mental health. So marijuana is also a part of those drugs that we are looking at and seeing how we can address in the communities.
All right, all right. Now, Deborah, let me jump to you. Mass 2 Coalition.
Mass Call 2.
Mass Call 2.
Yes.
All right, what are we talking about here?
Okay, so the coalition got a grant 3 years ago from the state. And it's administered by the city, Boston Public Health Commission, so we partner with the city. And there were 4 coalitions that got funded. And the long-winded name is Mass Call 2, that's the name of the grant. But actually what we're really doing is opioid overdose prevention, fatal and non-fatal, which basically means overdose from opioids.
All right, now what's an opioid?
Opioids are heroin, codeine, morphine, fentanyl, methadone. It's a class of drug, OxyContin. Tylenol 3 actually has a little opioid in it.
Yes, it
Percocet, Percodan, and so the class of drugs, opioids, put someone at risk for overdose because their breathing actually slows, if there's too much drug on board, slow, very slowly between 1 and 3 hours. And their breathing will stop, and that is what a fatal overdose is. And so our intervention, we are funded to work with the community. We've got 3 really cool interventions, and we're funded to work with the community in conjunction with the Department of the Boston Public Health Commission to do these really cool interventions to tell people about overdose, to tell people how to prevent it, and then how to reverse it actually while it's happening. So it's pretty cool, and it's been really neat.
All right, now when you say, those of us who grew up watching television, we've seen people who having overdoses in the movies and on television. You know, the person laying on the ground with the phone coming out of their mouth and starts shaking, and the eyes roll up in the back of the head and all that. Is that what the person on the street is supposed to look for?
It's not always that dramatic.
See, I knew that. So
most overdoses happen between 1 and 3 hours. They don't happen instantaneously, like there's a needle stuck in your arm and then you die, and your tongue.
And the tongue. I forget the tongue. I was going to say, I forgot the tongue. Don't forget the tongue.
Right, the eyes run.
The eyes roll back, right.
Sometimes it happens quite quickly, honestly, but most times there is time to intervene, and that's the message we're trying to get out. Call 911, do rescue breathing, and then use Narcan, which is a non-narcotic. It's actually a mist, a spray, and you just spray it into someone's nose, actually, and it bumps off that drug that's sitting on your receptors and lets you breathe again. And we're trying to get as many people access to that and let people know. But our 3 interventions are very specific with inmates. We're trying to tell inmates about it because we found people OD when they get out of prison or jail because they've had a little bit of abstinence and then their body's tolerance has changed. And if they pick up when they get out, then they're at increased risk for overdose. And then we're working with police to let police know what overdose is. Very cool e-module that the police department, Boston Police Department, is actually working with us to create in conjunction with the Boston Public Health Commission. I should say that's an intervention with all 4 Boston coalitions, South End, South Boston, Charlestown, and us. So I don't want to take credit for them. The other intervention is working with active users on the street.
Now, I was reading some data about and they've put the website up there already, and they're going to do it again before we're done. I saw some data about the odds of overdosing after folks get out of prison. Is that only because of the fact that what would cause that? I mean, you've been incarcerated for a while. You obviously are no longer got that urge to do so, and then you get out.
Well, I'm not sure about not having the urge to do so, because if you think of addiction from a medical model, right? It's a medical problem that needs treatment, and sometimes when people get out and they don't have access to treatment or support, they might pick up again. And what happens is, and actually it's true also if you've been in detox or substance abuse treatment, any reason where you've had a sustained period of abstinence, meaning not drinking or drugging at all, or reduced use, actually. Anytime you've had that period, your body's tolerance has changed. And if you pick up and use at the same amounts as you used to use before you got into detox or prison or whatever, it's too much for your body, too much drug for your body to handle. And that's when fatal and non-fatal overdose, you're most at risk for overdose. So in the community of Roxbury, Jamaica Plain, we asked folks in the community, when are people at risk? And people told us, when I got out of prison, I OD'd within 12 hours. Or I hadn't even reported to my probation officer yet.
Wow.
And I OD'd, because you pick up and then your body can't handle it. So we actually go into South Bay, Suffolk County House of Corrections, and we tell the guys, when you get out, you're at increased risk, here's what you can do. Go get Narcan at A-Hope, which is at 774 Albany Street. It's a program of the Boston Public Health Commission. They do needle exchange and Narcan and overdose prevention. We tell them how to rescue breathe. We tell them call 911, because don't forget, overdose, you can either be overdosing yourself or you can be witness to one. So the messages are a little different, but we tell people when you get out, you're at risk. So here's the things to look out for.
Now, let's talk about the education in the prison. I saw in your information that you reached out to over 600 inmates.
So far, we're very proud of that.
Yeah.
You should be proud of that. That's
and then what's happening is that the prison is actually...
Well, there are some case managers and supervisors in-house at the prison that they realize that it's very relevant for their population. And they're really invested in it. We've been really psyched. They've been so collaborative and really great partners. We thought we'd have to sort of fight tooth and nail to get in, and they've been wonderful.
Because, you know, denial is a wonderful thing. There's not a substance abuse problem.
Well, they have a huge treatment unit. They have several different substance use units at South Bay. So they're very invested in working with us, and it's been really great. And so one of the supervisors, actually, John Dolan, took on doing groups himself. And last week he graduated a group of 6 inmates, started out 6 inmates out of this peer-driven intervention. They met for 6 or 8 sessions, and there was a big graduation ceremony, and now these guys are ready to go and teach other guys in the prison informally. And then when they get out, we're going to offer them a little bit of an incentive to continue to teach others. It was so wonderful. I had goosebumps when they graduated. They got up, they spoke in front of the class. It was so great. The assistant superintendent was there. The director of social services was there. Everyone was clapping, and I was crying. It was so good.
Perfect circumstances, you know. But that, now see, that's pretty cool, because, like I said, I didn't realize that there was that big of a problem of folks getting out. It does make sense. You're going to pick up where you stopped.
Yeah.
And if you were able to hit it pretty hard when you stopped, they're figuring you can still do that.
And it's actually not uncommon within the using community that folks actually go into detox just so that they can get a better high when they come out and use. So it's not an uncommon practice, and people not really understanding in terms of their tolerance decreasing and how does that impact the amount of drug in which they decide to take in. So yeah.
Now, Deborah, you mentioned something, and I want to hit on this before we move on. Pun on words there. There's a drug that folks can use to help reverse an overdose.
Yes, it's called Narcan. And it's non-narcotic. It is prescription, but you can go and be trained on using it. This is what it looks like. I don't know if you can see that.
It looks like a nasal spray.
Yeah, it's like, but it's a long, yes, it looks exactly like a nasal spray. Okay. And what we're encouraging people to do is should I hold it up? Can you see it?
There we go. Okay, really good.
Good.
So what we're encouraging people to do, if you hang out with people who you might witness an overdose, or if you have family members, somebody who, maybe a nephew or a son or a father, somebody who might hang out in your house at night or during the day or whenever, to have the Narcan on board, go to AHOPE. They will train you in how to use it. It's very simple, but they will make sure you know how before you walk out the door. They'll give you your own little kit. They'll explain to you all about calling 911, how to rescue breathe, because it's all about breathing.
Let's talk about rescue breathing.
Yeah.
Because you've mentioned it a couple of times. When I always think of that, I think of CPR. But that's not the same thing.
Actually, cardiac arrest is when you do chest compressions. But overdose actually is entirely to do with respiration, and so it's all about, it has nothing to do with the heart, although it might eventually, but initially it's about respiration. And so you want to make sure you do rescue breathing while you're waiting for 911. Call 911, and then you want to rescue breathe. So lay the person down, pinch their nose, put their head back, and give a slow breath every 5 seconds until the ambulance gets there, and then give Narcan. Okay. And so the Narcan will pop off. Let's say heroin sits on your opiate receptors, and what the Narcan does is it pops the heroin off of those receptors so you can breathe again. Now the thing about Narcan is actually over a period 30 to 60 to 90 minutes, actually the opiates can go back on the receptor. Right. And so you can't just walk away from somebody Narcan and walk away. You really need to get them to the hospital and have them supervised, because they might actually overdose again. So it's not a cure-all, and we're really trying to tell